I'm Dr. Carrie. Welcome to Vet Ranch. This is kind of a different situation. I want to introduce you to a dog named Timber, and then we're going to look back at his recovery process. He is a dog that we had for over a year. We already had him when we got active again and we started Vet Ranch Roundup, so he doesn't have really the very beginning history when he was here, so I'm going to fill you in on that. He was 5 months old, brought in for lameness on his back end, and was found to have severely deformed hips. Let's take a pause here. Let me show you his original x-rays. So these are Timber's x-rays that we took while he was under anesthesia. They are terrible. He has like no hip socket, basically already a flattened head of his femur. And it's so bad that his hips are literally out of socket. I have never seen a dog this bad. You know, and he's been this bad since we first got him, probably about 5 months old, and we've just been charting his progress. We really wanted him to finish growing, you know, be completely done growing before we went ahead and did the surgery, but at this point we cannot wait anymore. So probably in a couple weeks we're gonna have him back, and then we'll explain the surgery at that time that we're gonna do. So as you can see, he was a mess, and the owners were not ready to invest in the time and expense and rehab that he was going to need. So they elected euthanasia. We elected to not euthanize, which is not a surprise for us. And the rest is history. So let's jump right in and just go from there. Oh yeah, the other thing I was going to show you about him was that we also have a really good video, probably one of the only ones we have when we first got him. He was such a playful puppy, but as you can see, he runs with almost like a bunny hop. So his back legs, they move in unison together like a bunny hop instead of independently, which kind of shows how stilted his back end is and how deformed it is. The other thing is he would play so hard like a puppy for like 1 or 2 minutes and then just be gassed because his legs hurt. So that was tough too, but it's pretty evident whenever you look back at his videos how severely affected he was. It's really hard for us to remember that too till we watch the videos. So I love reviewing that. How did he get so big?
I think I've got some drool.
We're under anesthesia and we're gonna get a really good feel of his hips, because honestly that's been really hard to do. It's been really hard to do because he's so painful when he's awake. We would kind of get to here and then he would scream and then I would feel terrible. And his conformation of his whole, both of his legs are just weird. His kneecaps are really loose. I know we were worried about that. And he just has so much muscle atrophy. Like he does not have nearly as much muscle as a dog his age would have. He's just a hot mess. We don't want to say it, but he's kind of a lemon. Today's the day. Timber's first surgery out of 2. He's gonna be a complete lean about it.
Oh, yeah, he's pretty mean.
What's on face, April? Okay, be careful. Timber gonna be weak. Eat okay, bud.
You definitely, got some instability over here, some clicking. It's not bad. Yeah, it's got some fusion in that knee. The toe, I can get it to kind of sit on that ridge, but that comes right back in. So people are worried about his toe as he was a baby, but I think those are actually better. So that's one thing. You need the hips feel about the same Caucasian was. This one actually is a little more frivolous. Yeah, that's, I think probably.
Then we can do his left hip now, and then that'll give him a stronger leg to walk on all that.
Let's see if we can recover from this FHO, and if he does great, then maybe we can do CPO FHO.
You're a lemon, dude.
Oh, I know it. He's a mega lemon. At the end of all this, you're gonna feel great.
post-op radiographs of Timber, and these are good ones to look at because you can compare the two sides. Here is the other one with the femoral head that's out, and then here's the one that had the femoral head and neck ostectomy, and then you can see that right there, what a clean cut. So that's not going to be rubbing anymore, and hopefully will alleviate a lot of pain. And then in a few weeks, we're going to go do the other side, and then we'll also talk about his knee, which he possibly has a torn ligament in there too. So he's a mess. Timber's having a rough day. He woke up pretty painful, so we gave him another big dose of hydro and ordered a little sling for him. So he's pretty out now, but he's having a rough time. Buddy, come on, you can walk. Come on,
Good boy. Well, I'm really not assisting him that much.
Good.
We are here with Timber, and today he gets his staples removed. There's a lot of hair growing over here, but that's okay. Seems like I think he was due to come back a little bit earlier than now, but we'll just get those staples removed. Sometimes it's kind of hard to see them. And more, just kidding. That's it. Great.
Good job, Timber.
Look at Timber. He's using that like really well today. He's about 8 weeks since surgery. So we are going to sedate him, palpate him, and see what our next surgery needs to be. Yeah, especially because we're not sure about that knee. Timber, don't you think he looks better, like he gained weight?
Yeah, it's creamy now.
Excuse me? Creamy of all?
Like a cream color.
He's creamy now. You said dreamy and creamy. Make creamy. Timber's radiographs still look great. Here's the other hip that we need to deal with, and definitely needs probably a knee surgery as well in this knee right here. So we are reaching out to Dr. Reed to see when we want to plan that and then start phase 2 of 3. Well, it is second surgery of probably 3, but we'll find out once we get this little dude sedated. Little dude sedated. Yeah, go for it. He's going to be a little...
You're a good boy.
Don't put your face in his face.
That's a good boy.
Hi, we're gonna fix Timber's hip today. He's excited, if you can't tell. He got a little bit of medicine and made him a little bit drooly. So we're gonna give him something for his nausea. But look how handsome that face is. And he's so happy, smiling. The boy. Ready. Boy.
the post-op x-rays and it looks great. This head is gone now. These are the staples in the skin, but I was like really confused because I was like, what is this? Apparently this is some kind of toy or spring that he ingested, but it's in his colon about to make it out. I have no idea. But we'll see him in about 2 weeks. Timber's ready to go back to foster day after surgery. You ready to go, bud? Oh, he's gonna dopey. Hi, Timber. Look who we're
Right
rechecking.
leg is the one we just did, right?
Yes.
So his left leg is the one that needs his TPLO.
I'm pretty sure
Schedule.
the right one needs the PPLO.
He's got a weird knee.
Something's going on with that right side then. Look at it.
Well,
Why
he
is
does
it
that weird.
twisting out like that?
He does that weird hyperflexion of his hock too. Come on. Come on.
Why is he doing that? What do you weigh?
Say 67.
He looks so much bigger than 67.
He's fluffy.
Left FHO done several months ago, right done 50 days ago.
Yeah, gotta get it head on. What is he doing with that?
Now we're trying to figure out why he's turning that leg. That's a good view. So awesome. Timber just left and I realized that I did not finish talking about what our plan is going to be. Basically, we're going to recheck him in a couple weeks. He has an ear infection and I don't love the way he's walking on that leg, but we're probably going to have to sedate him and feel his knees. It may just be loss of muscle in that leg as to why he's holding it that way, but we'll see what we need to do probably actually 3 weeks from now. Talking to the surgeon, it looks like Timber needs a little more care than the foster can provide, so we're going to keep Timber here for a while. Are you serious? What? And do some physical therapy and getting ready for the next surgery. And then we're also going to see Timber and play with Drama to have a friend. Because you don't have any dog friends at the fosters. Thinks you're so cute. Hello, Megan.
Show me your little hop. Show me your little hop. Come on. Good boy. Oh, that's okay. That's okay. You're so cute.
Timber, are you getting some glamour shots? He is so cute. Come here, handsome.
Keep her collar on. I think he's turning out left on you.
Yeah.
Yep, definitely.
I mean,
He was like over 90 degrees out before.
It was bad.
And I figured it was because he just didn't have good muscle around that hip and he had to build it back up.
You need to hold him though, because he's not good when you palpate him up there. He's just, I think he's just over it.
Right? Like, so say your dog, say I'm showing this dog and he has a terrible top line, I'm gonna wear like khaki pants so when we walk you don't see how bad it is. But if he looks good, then I'm gonna wear black pants so you can see it.
Oh, wow.
Yeah. You ready? We're gonna do a showdown bump one more time. Ready, go.
I was only showing Wendy.
Great.
You want it? We were just looking at Timber's old x-rays with Dr. Reed, and she agrees with us that his PT is going well, so we are going to hold off on any surgery for now. So exciting. Dog
Drug testing Harper. She's a spaz. Official diagnosis.
Her like having friends.
So I have friends.
Timber, be nice.
She's like
Get away from me.
a deer. Yeah, I know. I don't want to be in the middle.
She's one that will knock your legs out.
Yeah.
Guys, we are telling Timber goodbye. He is gonna go on transport and I will be out of town when we leave, which is sad. But it's pretty bittersweet. Actually, it's sweet because he's gonna go to a foster home and he has lived with us too long. Since he was a puppy, I feel like he's been here, just a big goofy puppy. So he's ready. It's time to get into a foster home and get a real home. So anyways, we just want to say thank you guys so much for all your support. Thanks for watching our videos. We could not keep little lemon dogs like him without you guys.
Or big lemon dogs.
Big lemon dogs. Big lemon problems, big dog. But thank you guys so much and we'll see you on the next case. Bye.
You ready, buddy? He's like, I don't know. You're going on an adventure. You get to go be on a farm. You better water all those flowers before you go. Every single flower needs some timber water.
Which one's going this way?
He is either one.
No more bushes over there. Aren't you pretty?
So hi, my name's Timber. I don't know who you are.
It's okay. Good boy.
He's like, you got some food in there, baby?
He said I can read.
Is that black?
He's sometimes a little.
Usually the most popular.